million veterans, they rely on the VA for health care. And when you start freezing things, and when you start scaring workers, and when you tell them you don't want them to work for you anymore, what do you think happens?
You're going to hear that, oh, we're not cutting benefits. What they're cutting are the people that process the benefits.
All right.
You're going to hear, but we're not cutting health care.
Yeah.
But what they're doing is they're firing the nurses and the staff that take care of you in the hospital.
There is no way that their services and their benefits go uninterrupted when they've decided to declare war on the very same workers that protect and serve our veterans.
Democratic members of Congress and senators protesting outside the VA headquarters in Washington today, trying to defend the VA from what the Trump administration is doing to it. That was this morning, that protest. And now tonight, since we have been on the air just a few minutes ago, the VA has just sent out an announcement that it is cutting more than 1,000 employees from the VA. Joining us now is Leo Shane. He's deputy editor at the Military Times. Leo, thanks very much for joining us. I appreciate you being here.
No, anytime.
Let me ask your reaction to this news that's just broken, that they're cutting 1,000 employees out of VA.
Yeah, look, this is a small number in comparison to the entire VA workforce. VA has about 480,000 employees, so it's not necessarily something that is widespread, but we still don't really have a handle on who these folks are. VA's press release, as you said, says they're not mission critical folks, but I've already gotten calls from a few sources saying that at least one employee from the Veterans Crisis Line was laid off. That it's someone who was not in a position where they're answering calls of suicidal veterans, but they are providing support services. So we just don't know exactly what these cuts are and who they are, how deep they'll get into veteran services.
Leo, one of the things that I wanted to talk to you about was the sort of distance between what the administration is telling us and what reporting is telling us is actually the impact of the treatment of the VA thus far. So very early on, after Trump was sworn in, we got news that they had changed their mind on the hiring freeze as it applied to VA, and people coming into work in VA healthcare jobs, doctors, nurses, counselors, and others, they had previously been told the hiring freeze would apply to them, but then they had changed their mind. We're now having open source reporting telling us that whatever they said about their caving and changing their mind on that, people who are new hires into the VA health system aren't able to take up their jobs. Does that comport with your understanding of what's happening?
Yeah, I think there's just a lot of confusion right now, and even some folks that should be exempt, their supervisors aren't sure if they should be processing, if they should be bringing in new folks, exactly what the problem should, how to deal with this issue. So I think maybe in a few weeks there'll be some clarity. Maybe there will be some idea that these folks are exempt and that they'll start filling these positions. But at least for now, it just feels like chaos. It feels like a lot of folks don't know, will I be onboarded? Is my job gone? Is this anything we can do?
In addition to that chaos, there's also been a lot of concern in a lot of government agencies thus far about access of the Elon Musk quasi-governmental effort in which they're accessing even sensitive and in some cases apparently even classified records and information, not just about the functioning of agencies, but individual personnel and citizens' records as well. Obviously, the VA handles an incredible amount of very sensitive information about millions of American veterans and their health care. Have you heard any concerns or any reaction among the veterans community about the idea of Elon Musk and his guys getting access to people's sensitive medical and other veterans' records?
Yeah, look, lots of concerns about that from the veterans community. Now, VA has been clear. They've said there's one employee from the Department of Government Efficiency that is already working with VA, that they're only looking at contracts. They're not looking at sensitive veterans data. They have tried to react to that and to put out there. But you've seen what's happened with some of the allegations in other departments, other agencies. There's just a worry that anything that is being done by the Department of Government Efficiency, is that going to be the extent? Could that very easily go into some of these, as you said, these sensitive personal medical data, benefits data, things like that? Folks just aren't sure. So I think